Being here today and listening to some of the stories and intertwining the cultural with facility is really a game changer. It's something that we've talked about for so long, but it's something that we really want to now start really incorporating, like by having our gardens and by having more representation. Like, it's not just that material stuff, it's like, you know, we talked about today, like the environmental spaces as well.
We're here to learn more about Aboriginal people and their connection to country, and in particular what we can do to develop Fairfield Hospital the right way so that we can connect with country. This sets the tone for the rest of the build. It puts Aboriginal culture in the forefront and sets an expectation that Fairfield Hospital will deliver not just services for the community, but a place of belonging for the Aboriginal community.
Events like today are really important for us to hear from community, to listen deeply, to learn and provide meaningful action through the redevelopment. When we have the opportunity to listen at this stage, we can fold in the things that we hear into the DNA of the redevelopment at a really early stage, so that informs every step along the way through planning. It's a facility that hasn't had a redevelopment, so we really want to make sure that it's a significant improvement and contribution to the community.
To be here today advocating for my people, for myself, for my family is huge. It's a really big deal. Excited to see what's going to happen in another 10 years from now.